Okay, front of the ledge. No Dan BCA, no. Everything's fine, no protests. Quiet. Somebody I really want to talk to here. And what's your name?
Bill Fraser, MLA for Miramichi Bay Divin.
Also the advocate for health? What do you call yourself?
Advocate for the Department of Health, yes.
Liberal?
Liberal MLA.
Outspoken?
Since 2006. I don't know if I'm outspoken or not, but I represent the people that elected me.
Oh, I seen you. I don't watch bullshit question period too often. That's why I call it bullshit question period. But anyway, I watched it. You had Madeleine Dubé. You weren't even looking at the speaker's chair. Madeleine Dubé, you were angry about healthcare issues, and Madeleine Dubé was blah blah blah. Like I think it was per Andover Hospital, or something like that.
Sure. Well, there's a number of issues, Charles, in the healthcare file. Of course, you know the budget was just released not that long ago, and right now we're going through the budgetary estimate process, and that's the time where the Minister of the Departments come in, and they're there to answer questions of the official opposition.
Yep.
Questions that people in New Brunswick have, so that people are aware of what's in the budget, what's going to come forward, what new services or programs might be offered, but also what cuts people can expect so they can prepare.
And you're wondering how come I wanted to talk to you just out front, but this is the issue. Now, do you remember Russell King? Russell King was the Minister of Health in the Frank McKenna regime. Lou Murphy, the great Lou Murphy, he's dead now, God bless his soul, fought hard for the cut against St. Joe's Hospital. Mm-hmm. You got the Furlong with Bernard Law. Elvira Bichot was the Minister of Health. You got the Mike Murphy, and then now you got Madeleine Dubé. How come it don't matter, the last 30 years, it don't matter which political party that's in opposition, everybody bitches about healthcare.
Well, Charles, healthcare is something that affects everybody in the province. Every man, woman, and child. There's nobody that it doesn't touch. And it's a very, very important issue, and it's something that affects us all, and it's something that everybody's going to have access to in New Brunswick.
I know as role at the opposition, that's what you got to do, bring issues. But it seems, since I've been involved, that healthcare is always bring up in the forefront. If you're appointed Minister of Health tomorrow, Madeleine Dubé is in the opposition, you'll be doing the same thing. You'll be protecting it, and she'll be condemning it, the cuts. It never changes.
Well, Charles.
You follow me?
In 2006 to 10, when the Liberal government was in power, and there was two health ministers in that watch, Mike Murphy and Mary Scryer, we never seen the attack on frontline services that we're seeing now.
Are you sure about that?
Oh, well, I don't recall any protest in front of the legislature concerned about health care. Back in 2006 to 2010, yes, there were other protests.
They were too busy about NB Power.
There was no huge concern, especially and in Miramichi. I know, for example, prior in the LV Robichaud was health minister in the Bernard Law government, they tried to gut services at the Miramichi Hospital and take beds out of our community. And there was a huge rally, and I think that's where you and I first met, Charles, in front of the legislature back in 2004. 2006, the Liberals came into power under Sean Graham, and I'm speaking specifically of Miramichi now, because that's my community. We invested heavily in healthcare in Miramichi. We located the headquarters for Horizon there. We increased the number of dialysis seats by double. Almost $1.5 million annually in the budget, so that people wouldn't have to be on a wait list to get dialysis or have to travel to Moncton for dialysis. They could do it right in the community of Miramichi. We invested into the chemotherapy center in Miramichi, so people could do their chemo treatments in Miramichi. We invested in putting medical training, Dalhousie Medical School, actually, and it was just opened in the last couple of months in Miramichi, where there's doctors actually, people training to be doctors located in the Miramichi Hospital. So there was no fear of cutbacks of service back in those 4 years. Now all of a sudden, we're back on the same Tory agenda that they had in 2004, where they're trying to gut services out of the hospital. And this time they're trying to do it by stealth, Charles. And what they're doing is they've taken 2 wings in our hospital, 1 east and 4 east, and they've converted them over to nursing home wings. And they're doing this slowly but surely, so that eventually the Miramichi Hospital is not going to be a full-service acute care hospital. It's going to be a semi-hospital, semi-nursing home. We had a plan in place to build a new nursing home in Miramichi to replace one of our older structures that's not safe, Charles. This government came into power and canceled that plan. Was it for politics? I don't know. That's a question that the Tories will have to answer. But I know it's wrong.
You know Brian Kenny?
Yes, I do.
And when he was Minister of, what was he? Special
Minister
care
of
home?
Seniors, yes.
Seniors.
Yes.
I seen him a week later, and he had almost like he seen a ghost. And he couldn't, but he looked at me and he go, I said, how's your job, your new title? Charles, you should see the money. And the way he was talking, he was really, really concerned what's going to happen in 20 years from now. So he was a liberal, and he's seen what could happen, and what you're saying about the old folks home. We got a problem here, and it don't matter if it's the liberal or the conservative. I mean, we do have a problem.
Absolutely, I couldn't agree more, Charles. There's a problem in Miramichi, just like there's a problem in many other communities right across the province. The new nursing home plan that Minister Stultz had put out has seen a reduction in the number of beds that was in the previous plan. She's changed the plan around so that they're going to try to solve the problem by creating 3B beds in special care homes, not nursing homes. And that is not the type of service that those seniors and those elderly people need. They need nursing home care when they're in that state. We need to invest more money in nursing home beds in the province, more than they have.
If you were Minister of Health, what would the people be complaining about?
Well, you know, I think the Minister of Health needs to work in collaboration with the Minister of Social Development, and I don't see that happening right now, and I think that's a major problem. The situation with many of the hospitals, and in particular Miramichi, as I said, is all of these patients that are in the hospital waiting for nursing home placement. Some of them have been there as long as a year, Charles. And the only way you're going to solve that problem is to build more nursing home beds and take those patients out of the hospitals, out of that setting. Now, the solution to that, Charles, lies in the Department of Social Development and in that budget. But the problem rests with the Department of Health. So unless those two departments get together and start to collaborate, I don't know how we're going to solve the problem.
That's why I try to cut you off. I didn't know really what. That's what you're getting at. I hear a rumor that they're going to shut down the Miramichi Hospital and move it to Batters and have the Miramichi Hospital changed into an old folks home.
Well, I don't think it's going to be that drastic, Charles, but I think the fear is, back in 2004, there was a plan to have Bathurst as a central hospital for the north and have Miramichi and Campbellton and all these other northern communities feed into Bathurst. Now, we've already lost 36 acute care beds out of our hospital. We've gone from 161 acute care beds, less 36, so we're down to 130 some now. And if that trend continues, Charles, that's exactly, we're going to end up having something similar to what they have in Sussex.
So we don't have no money. Yeah, we have no money. So maybe it's a federal issue.
Well, I mean, and that brings up another issue. Our Premier, David Alward, as recently as Christmas time in December, had made an argument with the Prime Minister over the federal health transfer payments.
Yeah, that's right, I remember that.
Saying that, look at, Prime Minister, our health budget needs to be maintained at a 6% increase just to keep the status quo here in the province of New Brunswick. That was the argument he used with the Prime Minister in December, because the Prime Minister is looking at changing the health accord and changing the funding formula.
Oh, somebody changed a lot of things.
Well, absolutely. So here we have the Minister of Health bringing her budgetary estimates before the legislature with an increase of 1.6% in the healthcare budget, after David Alward and the Tories committed in their platform that it would be a minimum 3% increase. So, and these are precisely the questions that I was trying to ask in the House. I found it very frustrating, Charles, because the minister is very political. She's very good on her feet. She's well experienced, well versed. She's been in this game a long time. Mm-hmm. I wasn't being political. I was asking questions about what's going to be cut.
I see.
Because if you look at the normal expenditures for healthcare in the province of New Brunswick, it's somewhere between 6 and 7%. And David Alward confirmed that we need 6% to keep the status quo. So if you look at an increase of 1.6% as opposed to the 6 to 7%, you're at about a 5.8 or a 6, 5.88% decrease, basically, which represents $136 million. So that goes to tell you there's got to be cuts if you're going to save $136 million in the healthcare budget. And all we were trying to do as an opposition, as a health advocate, is to find out where are you looking at finding these efficiencies and how are you going to do it? Because there's a lot of fear out there in the healthcare sector, not just in Miramichi, but all across the province. A lot of fear as to what's going to come. And
so what comes? Okay, what is going to come? So, in 2018, when you guys get back in power, you'll be the Minister of Health. So if I haven't been shot and you're in good health, we could have this interview saying how come you as Minister of Health we need to do these cuts.
Well, Charles, I can't predict the future. I don't know what's going to take place in 2018. God willing, we'll both still be here.
Bottom line is, it don't matter which political party, but you say the Liberals, the last, didn't do that much drastic cuts than what the Conservatives are doing now.
Well, you know what? We found a lot of efficiencies in healthcare in between 2006 and 2010. We didn't attack frontline healthcare services. We didn't close hospitals. We didn't close beds. What we did was we went after administration. We took, the number of boards and the number of health authorities, and we brought them down to 2, which created a lot of efficiencies within the system. We went after the bureaucracy, not after the frontline service, and I think we need to do more of that, not just in the Department of Health, but all across government.
Listen, we'll do this again. Thank you.
You're welcome.